Don't smile.
Okay, can I call the meeting? Okay, calling from the City of Florida meeting, July 13th, and it is 5:41.
For the roll call, we'll start with Jack Amarai.
Here.
Pam Ferguson. Here. Emily Matter.
Here.
Michelle Frederick.
Here.
Louise Frederick.
Here.
Joan Seidel is here.
I see Rose and Chris are here as guests. Is anyone else joining? Okay. We can start with the back nursing disease report. Oh, we need to do the minutes. Oh, okay. Chris will need to be excused. Is there a motion to excuse Chris for today?
So
Second.
Okay. And then the minutes from the May meeting, there was no meeting in
You need
June.
to vote. I think you still need to vote. So we have a first and a second and just all those in favor.
All those in favor?
They vote.
Aye. Anyone against it? Okay, motion passes. The vote, Chris is excused. Next is the minutes for the May meeting. There was no meeting in June.
Can I ask a question? Sorry to interrupt. I didn't attend, so I can't vote on it. Are we okay even though Chris is absent? Because there's still three. So we're still okay, we're still, okay, just wanted to make sure. Okay.
That's okay. Any other comments or questions about the minutes? Is there a motion to approve the minutes? I motion to approve the minutes from I'll second. All in favor? Aye. Opposed? Okay, minutes are passed as is. Are there any opening comments or guest comments? Okay, we can move on to the reports. We'll start with the PEP in nursing communicable disease reports.
Did you want to do May and June or just June?
Let's do May and June. Well, anything of importance in. Yeah.
Okay, so you have the information there in front of you for June or for May, I'm sorry. Not a whole lot going on. We're starting to see the communicable diseases rise. And just to let you know, any type of Legionellas, the state's on it big time. I've had 2 already, and within 24, 48 hours, they have been calling me and actually having our EH department go out and investigate just to see if there is anything. So just to give you guys a heads up on that. So for right now, for May, we're up to 31,937 vaccines. We are trying to get everybody vaccinated as we can. We've opened it up.
Oh, you froze, Rose. Yeah. I think she's still frozen. I think she's.
She was unfrozen for a second.
Yeah.
Here she is.
There. Nope.
Nope.
Hey Rose, if it's easier, you can turn off the camera. That might save on the bandwidth. These are COVID vaccines.
I believe so. Yeah. Still can't hear you, Rose.
So they're not gonna miss school.
I know, right?
Of course, it's like our first and
I know. And we did a dry run and everything. You know, like I sent her over the water, I try to call, see if there's any issues. It was fine.
It's not ionizer, maybe,
Pardon me?
maybe it's not ionizer.
Oh,
We'll have to speak up a little bit, I think.
is she dry?
She'll text me.
I'm gonna ask her to just call her. When she comes and say,
But she's a minister, they can be from outside of the county. So
Oh, yes,
sometimes-
yeah.
So this 31,000 doesn't represent Portage County, at all, it
Penny
just
Paxton,
represents.
Penny Paxton may be breaking it up, because I know she said that she was gonna try to get us at specific vaccine numbers. So those may actually be Portage County specific, because I think they're able to sift through and sort that way. I'm not 100% positive, but that's something to clarify.
Well, there are over 100,000 people in Portage County, so that's not good.
Yeah, well,
Especially
we're-
if that's
we're-
including everyone, not
Right,
just the
yeah,
county. Is that really, and then it goes on to say that they're still going into nursing homes and doing whatnot. You would think everyone over 40 is. You know, if they- like, yeah, like if you're going into a nursing home, you would have thought you would have been.
You know, but there's still new people coming into nursing homes, you know, so they're always getting fresh residents and they're always have a lot of
People should have
turnover.
already been vaccinated.
You know, they're
Not
cutting away from the
necessarily, a lot of them
hospital,
have
the
not.
older patients who don't know how to go get vaccinated themselves, they don't have really the support for family, to arrange the appointment and all of that.
But when they get into the hospital, do you guys vaccinate first? You don't? No.
So that's
Everyone
what I
asks
think there's.
for it.
And you don't do
Yeah.
that? You have the pneumonia vaccine?
What about the COVID vaccine? I'm like,
Why aren't you doing the COVID one?
Well, I don't know.
That's really surprising. That would really reach a lot of people.
See, Acme and Stowe had a big sign saying they're giving free COVID shots, so that's the first time I've seen that. So,
Oh, we do
I'm
so
sure-
many.
I'm sure you do.
So I don't know if that's a typo, because in May, there's one, Legionella, and then in June, there's one Legionella, but the total for Portage County is still one, so I don't know if that's two,
Same.
or if it's the same, but they're different months. But I know, Legionella in the wild usually increases its rate of production in the amoeba that it grows in, out in ponds and things. So usually in August, there's a spike of Legionella growth. But, yeah, so I'm not sure about
Those
that.
rows.
I don't know, I'm a little bit concerned about this meningitis. It's bacterial, but not Neisseria, which is good. But I don't have any background on that, which would be nice to know in this, Salmonella.
We can hear you, Rose.
That's gonna be frustrating on her end, because there's nothing worse than trying to present and the technologies out there for you.
Once the council, people then, you know, all of a sudden they're no longer there, and we have to sign back in, and it's.
I don't have any background on that. And I do know the measles though, because the Ohio Department of Health called me and asked me to follow up on that they felt it was vaccine related. It was a breakthrough rash after the child was a 1-year-old was vaccinated. So that's not a true case.
Your call cannot be completed as dialed. Please check the number and dial again. No es posible realizar la llamada tal como se marcó el número. Favor de verificar el número y márquelo de nuevo.
Want to move on and like, what's the responsibility? You know what that, immigrant investigation. If we don't have it, I'm just curious what it is.
I don't know. Yeah. I know that we had a traveler that would come from the Democratic Republic of Congo right before they lifted the restrictions for traveling for Ebola. Okay. And so we did have to monitor that individual for 21 days. Yeah. I don't know, yeah, if it was something like that.
What does that monitoring entail? What do you, they just check that every so often?
Yeah, because it was near the end, we just had to check and tell them, you know, like if they have any problems, they have the first call and we'll help direct you to services. And then, you know, like, the same person. So, yeah, okay.
It's like it's fine.
Okay.
In the meeting.
Okay, so we will move on to the statistical reports for May.
One thing I'd like to point out in May, the smoke-free complaints, there's $500 that came to the Department of Health. So Mike, I don't know if you want to give any detail.
No, I don't.
Okay. Outside.
They paid on time and willingly. That's all.
And now since, you know, all the orders have been rescinded, there won't be any mass gathering citations, so those will no longer be collected.
Are all the swimming pools open?
I think that there might be one or two that are still thinking about it, but Justin was out today. He's been out last week and this week trying to get people up and running. Yeah. A number of them seem to go. That I think, I don't believe they're not open to the public. Okay. Maybe for the students.
Yeah, my kids are swimming there.
Is there anything about the June report?
No, I don't think there's.
Will that
Hold on.
bring us to the health department report? All right.
Hold that thought.
Okay.
Hey, Rose.
Hi, you know what? Let me close my computer.
Yeah, we're getting a little bit of reverb.
Okay. Okay, that should be better. Can everybody hear me now?
Yes.
Yes. Thank you guys for being patient. Okay, so the vaccines that we administered for May were 31,937. And as you can tell, that is from December. That is everybody in Portage County that wants it. So we go to nursing homes on an average of at least once a month. We go to the jail at least twice a month. And anybody that wants vaccine, we offer vaccine. We are having a Tuesday clinic, and today our clinic, we had 27 people get vaccine for COVID. We stopped using the VMS system. Sometimes it was a cumbering system, so they just actually called the health department and were able to get their information a lot faster and set up appointments a lot quicker. I'm saying that we still look in there to make sure that nobody else is trying to schedule through VMS, so we do monitor that. As I was talking about the communicable disease, especially Legionella's disease, the state seems to be very adamant about getting that information. I try and put all of the information into ODRS with everything I have.
But now they're really seems to be stepping up the plate. So we're stepping up our game at Portage County, especially with the environmental system, the health environmental department. They'll go out and they'll and do a quick inspection to see if there's anything that could be out of the ordinary that people don't think about. And then we will recommend just a little bit of testing that's not too expensive for the people, because I know some of those testings can be very expensive, and you can't really test for Legionella, but you can test for everything else. So we're still working increasing our CMH with our children with medical handicaps, getting that back up and running again, because as everybody knows, it's been on hold since the COVID. So trying to get all of that together, and Mary Ann's been doing a very good job.
Can I interrupt for just a second on the main report? Do you have any background information with you on that bacterial meningitis that was not Neisseria? It was in a.
You know what? I do not have that, and I don't want to look it up and take too much time. But I can always. But it was not bacterial meningitis. It was probably the viral meningitis, which we're starting to seeing a lot of upper respiratory infections. I don't know about, anything going on, but there are stuff going on. So a lot of people have been having upper respiratory infections that we've been seeing, and negative for COVID. So at least I'm glad they're testing them for that. But I'm sure it's just a viral meningitis, but I can double check on that and get to that.
Okay.
Because we may not have had it completed by the time Penny ran her numbers. Is there any other questions?
What is the immigrant investigation?
I'm sorry, I didn't hear that.
The reportable condition of immigrant on the communicable disease?
Is that in May?
Yeah.
That was in the May report, Rose.
Okay. Let me try and see where you guys are at. What page are you guys on? Did you see?
That's on table 1 of the May communicable disease totals.
Oh, okay.
Right under the hepatitis C, right under the hep C.
Okay. Okay, here we go. So it's okay that we have a possible TB that was an immigrant investigation. So that means she came, she had some markers, but however, she is not communicable. She is not showing any signs or symptoms. So with the immigration investigation, we have to follow through with that. And as long as she's not showing any type of signs or symptoms, we give her this information and we follow through with it for her to get to a doctor's appointment. Now, however, this girl, I know it's a girl, she said she does not have insurance yet, but she says she feels fine. She never had any type of TB, so I'm thinking she might have been just a positive reactor. And she said she took medication for like 1 year. So, and we'll just keep following up with her to make sure she's okay. So that's what that is. So we get alerted through anybody that's coming into our county that are immigrants from another country that could have potential communicable diseases that we need to follow up on. So actually, I was the one who followed up on her. Any other questions?
I guess not, Rose. Thank you so much. Sorry for the technological issues there, but thank you for sticking with us.
Oh, no problem. Do you want me to go on to June?
Sure, yeah.
Okay, so our numbers, as you see, for COVID has increased to 32,342. Again, it's the same thing. As I've been seeing that a lot of the managed care organizations have been reaching out to us as far as trying to hold vaccine clinics in areas they're actually interested in giving $50 gift cards, and there may even be a $100 gift card to get people vaccinated. We did that at the 6th annual drive-through senior forum. On the 24th, we actually have one coming up on the 28th for kids. And I've been getting bombarded with those calls because they want to do anything that we can. So if you guys know of any clinics that are going on, please reach out to me that they would be loved to come and just offer that type of information and to try and get everybody vaccinated. So saying that again, we sent letters out to all of the physicians offering to let them know that we're still providing vaccines. If they want to send their patients to us, they're more than welcome to. There's a lot of people out there giving vaccines, and that's fine. We've also sent it out to all of the nursing homes because, again, they have people coming in and out as you go through the month. So we try and get in there. And we send an email to every single nursing home that if they're interested in that or they need vaccine to let us know, we'll be glad to go out there. We are still doing home visits. We did 4 today. That's continuing. We just, as we see fit, we have a calendar that's specific for home visits, and we go anywhere and everywhere to do home visits. As again, I said, the jail, we go twice a month to the jail. That helps that because they do have a high turnover. Not to repeat anything, we do have a new nurse who will be starting on July 26th. So that's moving forward, would help us more with our communicable diseases because there's a lot more that we would like to do that we're not able because of our staff. We'd also like to work with the FQHC and get the Title 10 grant back. And that's one thing I would like to do since they are having a lot of people starting. So I'd like to go through that again and see if we can get it and do a little bit better job than we did. As you can see, you have a PowerPoint presentation on your PowerPoint. Actually, you had 2. You had one for the May and the one for June. So the one for May, and it's was regarding our EPI assistance that they've been really helping us. So I'm not sure if you guys know, but PCG is not allowed to send any more letters out that relate to positive people and them being in isolation and stuff. So that is something that we took back over with our EPI assistants. So they are able to do that now. And going through that PowerPoint just tells you a little bit of what they'll be doing and helping us out, which is really great. We need the help, and this is good for us. So the immunization one that you see back on for June was written by Kaylee Schaefer. She was our EPI intern. She was the Kent State University EPI, and also Brandon Dumont, and he was our EPI intern, and he just left. So he took that PowerPoint and updated it for us. So we go ahead and this is what we use when we do education for the school nurses and doctor's office. There's certain things that we have to do. The state is very particular about how we go ahead and get our immunizations, who's going to be. This time they're telling us, this is the school you do in this month, or these 2 schools you do in this month. So they're very strict now of telling us what to do, when to do it. Before they didn't. So when I had this program, I was able to do as many as I want for the year. So they're very well about picking who they want us to go ahead and get their immunization rates. So as you can see, Mamie, who's our nurse that has this grant, went through and was doing some information, and she put a little percentage with every school that she has done right now. So, and that will be continuing to be updated as she moves forward. So we also hired a new clerk. She just started on the 6th. So we're just getting her acclimated to our clinics. So Joan, you will be meeting her when she goes over to do the Kent clinic. So we're starting to see our Kent, or basically all the back to school clinics are starting to increase. So saying that, we're going to see an increase. We will be offering COVID vaccines at those clinics. So we're going to do whatever we can to get those kids vaccinated. I believe I overheard Joan talk to you guys about the measles case. Just to let you know, I did reach out to the physician. I reached out to the parent, and they were actually just doing a double check because the little boy had an MMR. He was fine. He had a fever from what the dad told me one day. My concern was that how his lesions were and if he was going to daycare or anything like that. So after talking to the nurse practitioner and also the father of the child does not go to any daycare or anything. He was all better by the time I talked to him after I talked to the nurse and ODH. So that is actually not a case. Is there any questions?
So will that be removed since that was like a vaccine-related breakthrough rash?
Yes.
Okay.
Yes. They were doing titers.
Titers.
This is one thing we have to watch when they do titers because it'll come up positive. And this is something that happens when you're given a live vaccine. They definitely can have a little rash or something. So I'm not sure if it really can be considered a breakthrough as much as sometimes that happens, but he is basically immunized and everything's good. Any other questions?
Doesn't look like it. I think that's covered. Thank you.
Oh, you're welcome. I am going to hop off. So thank you guys. Have a good night.
All right, thank you. Take care. Take care, Rose.
Bye-bye.
All right, we'll go back to the health department report, and I'll try to make this as brief as possible. So the public health alert advisory system is no longer being updated, and of course we're all aware that the governor rescinded the health orders in the state of emergency. Wisconsin, so the city also rescinded theirs. Our unified command team is actually continuing to meet once a month because we're concerned with the Delta variant, and we're also concerned with Penn State coming back that there might be abundant cases. From my understanding, PCG, which is the professional consulting group where all the Ohio Department of Health contact tracers went to, they're allowed to send out letters. They just can't be orders. Like our former notice of quarantine and our former notice of isolation, it said you are ordered to be in quarantine, you are ordered to be in isolation. Now we're suggesting or encouraging, and it's not an order. So that's my understanding. We're continuing to work with Penn State for the fall return to classes. They will be 100%. They will be in person. Their dorms are filling. I think they're doing singles and doubles, no triples. They are having distinct quarantine and isolation dorms, which is nice. They're making room for that. So they're doing a lot of planning, but they're going to have homecoming. They're going to have a big kickoff downtown for the first football game of the homecoming. So yeah, things are progressing. In terms of our case counts, we have 2,401 cases since the start of the event and 12 deaths. Thankfully, that has not increased. We have a total of 21 variant cases. None of those have been Delta. The Ohio Department of Health has also notified us that there have been they were tracking all breakthroughs, so those were fully vaccinated people 2 weeks post-vaccine that came down with COVID and tested positive, but then they shifted to only those that needed hospitalization. So there's 128 individuals who had breakthrough cases that were ill enough to be hospitalized. 20 of those have died, unfortunately, but again, we know no vaccine is 100% effective, so there's going to be there's gonna be cases where people do get ill, and unfortunately, some deaths occur. Tomorrow, Dr. Vanderhoff is gonna be giving, a WebEx at, I believe, 10 a.m. for, an update on the Delta variant. So I'm gonna try to get that in between the Unified Command Team call and then the Ohio Department of Health call. For the wastewater testing, Penn State is gonna be testing every single dorm on campus, which is great. We, had to hold off because of mosquito interns. So Eric had to drop out of that testing, and in the meantime, then they decided to use all those samplers on campus, so we don't have any off-campus sampling going on. We were hopeful that we might be able to get back into that in August. But in the meantime, we did have a meeting today with Rebecca Puget, who is in charge of this program from the state of Ohio, and she was working with the Ohio State University. So it looks like what they'll do is get sampling from water reclamation. So it won't be specific to Kent, off-campus housing. It will be for the city of Kent, and they'll do the student housing. So at least we'll get some general overall Kent information, which is good. We've been continuing to hold multiple small clinics. We have done, since we got vaccine, we've probably done, I think, 65 doses. So that's about as many as they've done in an hour in one of their early clinics in Portage County. So certainly not on the same scale, but we have gone to individual homes and done people who can't get out, and just low-income housing units. One manufacturer asked if we would come to their place of work, and we were there and did 14, so that was well worth it. And then we're looking to occupy the peddler space on the street level starting tomorrow.
Wow.
So that opens up for us. So we will be able to do testing and vaccination down in there. And Carta has also been very gracious about, I know some health departments are actually riding public transportation and trying to talk people into vaccines. But I said, if they've got a changeover and they're here at the Kent Central Gateway, they can just walk out and I'll get them vaccinated. So we'll work on getting that rolled out. We did get our pharmacy certificate renewed, so I was very happy about that. And then I did want to just add, under COVID, that I heard yesterday there was an outbreak in my Lewisburg, Ohio, and there were 800 people that attended a Baptist church camp. The majority of those individuals were between the age of 12 and 15, so they didn't really fit, and those were not vaccinated. Yesterday there were 30 positive cases from 3 states. Now there's 70 cases, and it looks like it might be up to 4 or 5 states. So they're continuing to look at that, but there have been, I guess, some concerns because people know, and they're not sharing that information when they try to do the contact tracing, and they won't hang up to their child having been. So that's unfortunate. There'll probably be more cases from that. In terms of the food service organizations, Justin is working with legal, the fire department, and service for an update to the mobile food cart with the city ordinance. There's specific laws that govern where they can be and when they can be. So they're trying to update that to make it a little bit easier on the restaurants who are struggling, but also to make it easier on the mobile vendors who paid for their license and they want to try to help make some money too. Justin is also initiating a QI project for operator fees. There's been some concern about the size and the occupancy and how, why does, a large scale business get charged the same rate as a very small independent. So he's looking into that, and they'll turn that into a project. The Bell Tower Brewery is moving along, and that should be open in August. The other thing that's come up is that many of the restaurants took the opportunity with the COVID closures to update their kitchens or whatnot. Unfortunately, many of those did not run through the planning process. They may not have gotten approval for what the changes that they made. So we're trying to work with them to bring them into compliance and have some dialogue that way, which is so far all been good. So, I think sometimes there's different facets, different perspectives, and we want to make sure that their concerns are heard and that they also understand that.
There are several of these then?
Yeah, there were a couple. Yeah,
Quite a number, yeah.
yeah.
I'm glad they're improving their facilities, but yet, yeah. Of course, that sometimes was a problem without COVID.
Oh, right, you know, like they're just gonna do this, just a quick little remodel and then she'll be a big deal.
I know you keep going on. Is the bell tower have food as well as?
You know, they're gonna have trucks. It's my understanding they will not have a kitchen, but they will have food trucks. And it seems like that's a trend that's becoming more and more popular and it makes it easier. If they're only serving alcohol and having the trucks, that works out really well. They don't have that whole kitchen.
And the Kent stage I see is opening. Will that be
Yes, they're
full
doing-
capacity then?
Yeah, well, they're doing some major renovations there, so we have not seen their plans for
It
what
says
they
their
plan
first
to
show
do.
is July 30th.
Yeah, and I think that's gonna be a very tight squeeze to get that open and approved, because for the end of last week, I don't think Justin has seen this.
Wow. That's close.
Mhm.
Yeah, I got it.
They're working.
Yeah,
fever
July
pitch,
30th, August, like all the way through, they have shows, but.
So I don't know if they'll open different parts and stages. I know they've got holes in walls. So, yeah, they're scanners. So I'm eager to see what it'll look like when things open up. Nothing new for housing inspections or body arts. For vital statistics, we did get the registrar job posted on the 16th of June. 38 applicants have applied for that position, so I'm excited about that, including our current deputy registrar is interested in that position. So Suzanne just sent me today, this afternoon, before the meeting, the top 8 candidates for review, so I didn't have had a chance to look at those yet, but I'm excited to go to those. The permitted numbers have increased in June on average since we started in February. And Linda has agreed to present in August. She'll come and just give a 6-month kind of update on how that's moving. Since we started, 6 other health departments have joined coming in as well. So we're kind of leading the way on that. The other thing that Linda did that I thought was really well beneficial to the budget, but also it was good that she took it on her own. Evidently, it's not the county, it's the state, owes us $1 back on each filed birth certificate. For some reason, in 2015 and 2018, that refund was not pursued. I think there was some communication issues. So Linda went back, she was working with the state, and we already have received 1 check for 2015, we'll receive 2018. And that will total over $3,000. So that's not insignificant money, I think, to leave on the table. So I was really pleased that she took the initiative on that. And then when it's time, she'll do the 2020 request for that refund as well. In terms of grants, I still need to do quite a bit of work to clean up the grants and see where our final balances are. But I did invoice for $20,000 for the vaccine needs assessment. I'm invoicing for the vaccine grant that kind of covers wages and overtime for anything related to vaccine clinics. And then the vaccine equity grant, that should finish up soon, and that'll total a little over $25,000. So, can we bring up the PowerPoint for the mosquito sunset? We did get approved for 2021, so that's great. I always wanted to see what exactly happens on a day in the life of a mosquito intern. I've seen him counting, that's pretty straightforward, very tedious job, but needs to be done. We have sent multiple samples down to the state of Ohio. So far, we have not had any positive pools from West Nile virus, which is great. You can just go straight to slide number 2. So on the furthest left is Eric, and then is Jacob. And they're just prepping the supplies to go out. The middle slide is Eric just trying to get samples, and you can see the little brown squiggly lines in that second. Those are all larvae. So some dips are full, some dips there's nothing. It's very interesting. And then the other picture is Jacob. He's spraying actually larvicide. There's a couple of means that we do either spraying or there's like pellets or briquettes, and you have to keep track of the number of ounces sprayed and where, and then the number of pellets you drop or the number of briquettes you throw. All of that has to be documented. You have to keep track of every piece of information. So it's a little bit documentation heavy. On the next slide, see, that's just us walking through. I think we did a 3-mile tour that day. It took about an hour. So you're moving the whole time. But for the briquettes, we have to space those like every 6 feet. So thankfully, I think Jacob was a football player. He's got really great. Because I was watching, I was like, he had everything spaced like exactly every 6 feet. So again,
Where are they at?
they are back behind. What is this? It's over by where Chris lives. It's back. Back and forth.
Plum Creek?
Yeah, no, not Plum Creek. This particular.
This is Forest Lake?
Mhm.
Wow.
I had no idea there was all this area between that housing and then Fairchild Avenue.
Right.
There was a ton of pools. And again, these are pools that we know of from Google Maps and just historically knowing that these exist and need to be treated. But then I went on the home and garden tour and I noticed the number of pools that people have in their backyards. I think 50% of the people that had their garden on the tour had some type of water feature. Now, many said, well, I have koi or I have goldfish, I have something that's going to take care of the mosquito larva. But, you know, I'm just wondering like how certain are we about it? How certain are we about that? So, and then
There's regulations as far as that goes, like a koi pond, or like what people need to do to maintain that to prevent the larva.
I mean, I honestly, I don't think that there's any, law
Right.
about it. And we might have to work with zoning in terms of do you have the space to put it in, but I think what happens in people's backyard is not
I
always.
didn't even think about those being like that.
I mean, just like even bird baths or low-lying areas in your backyard could be enough standing water for mosquitoes to breed. So it's very concerning. I am really glad we were able to switch over to the Aqua Zenivex, which that's the adulticide. So that's different from larviciding. The larviciding helps knock the numbers down. It doesn't take care of every single larva. So we're going to have mosquitoes. And we did do our first round of night spraying with the Aqua Zenivex, and Justin said he was really pleased with it. He was concerned since it's a water-based, product. Was that going to work appropriately? And it seems like it did. It said it was very easy to add to apply. So that's it for that. So I just wanted to.
I did see all of both years letters you had.
Yes, yeah, so I was gonna put that under, I guess, additional, but we could go ahead and speak to that now, because that was a concern. Mr. Pierre contacts the health department every single year.
I was gonna say, this has been a constant.
Yeah, I mean, he's very concerned about the environment, he's concerned about the health of humans as well as bees and other pollinators. So I shared with him that we went to a new product, and I shared with him that, they look to do nighttime spraying. They look at how fast the machine is going, how fast it's spraying, what's the wind direction, how strong is the wind. They look for drift and current. They really try to limit and just do enough application. I know that he's concerned that it doesn't get into the backyards. Sometimes it does. Justin and Erica said sometimes there's enough drift that it will get into backyards. But this new product, it will dry, and by the time the bees are out, it will not affect them. It does not affect pets, so cats, dogs, and birds are not going to be affected by this product. So I think that it's a better thing all the way around. Yet it's supposed to be as effective in killing mosquitoes as the other one. And I know a beekeeper, I think he's got a Kent address, but I think he actually lives in Burnfield. He said he was very pleased that we made the switch to this product from the research. And beekeepers do their research, and he was very pleased with it. But I had tried to respond back to Mr. Pierre and share all the information that I could with him. I know that he's still not 100% pleased. His suggestion that we partner with Portage County to rent a helicopter without pellets for larviciding. There's just there's no resources for that. And again, the larviciding is not going to knock them all down. This concern was that, you're over-treating for a disease that's not even current. You don't have any cases of West Nile, So what's the problem? Well, we don't want to have any cases of West Nile or equine, Eastern equine encephalitis. We don't want that. We don't want chikungunya either. And with climate change, those mosquitoes that carry chikungunya and Zika could be there. So it's better to treat and keep it under control and try to rein it in after that. So I don't know if there's anything else, but he did say when I spoke with him, I asked him if he wanted me to share his sludge with the board, and he said yes. He really felt strongly that the board should stop the program in its tracks and just not do any adult deciding, only do water deciding. But I don't think that would be a good program. So, and I know we want to try to focus some efforts to increase the education of the population in the city of Kent, to try to get rid of standing water, clean out their gutters so that all these places are not breeding grounds. But the other thing is we do have a no spray list, and not very many health departments have that. We'll notify, and then we won't spray those people who have filled out a form to make sure that it is, that they have an accurate attestation for their address. But then the problem is the numbers on their house are not big enough to read at night, and they won't turn their lights on. There's one individual that lives not far from where I live. He won't turn his light on because he doesn't want to have that electricity bill increase for the 2 hours, not knowing what time the truck will come out. But if he had his light on, they could read the street.
Give him a cord.
Pardon me? Yeah. So I mean, Justin has tried to brainstorm, like, could we put some type of reflective device on their mailbox? But that's a federal thing. You can't really mess with that. Is there some way we could stick something, in their front yard, in their tree lawn, so that it would be reflective and we know, hey, it's not straight here. So we try to do the best.
Let's say this year I've seen more lightning bugs than I've seen in a long time. So,
But we've only done one spray.
The parks are actually running lightning bug walks now.
Are they?
Yeah, cool. When the fireworks were going off, I went down to the river walk, and it was funny, the lightning bugs were going on at the same time. The explosions for the fireworks. It was a ton. So we'll continue to monitor and look at the. So I don't know if there's anything else you want me to say back, or if there's anything you'd like to address from his correspondence.
That was interesting to read, being that this is the first that I've heard of that program and everything. I think it was definitely interesting to have that.
I mean, he provided references there. So, no, we still, is there anything you want to update with tobacco? I know that there's ongoing programming going on with the tobacco grant.
Yes, so I submitted for Q4 2021 tobacco grant, additional $19,000, roughly $19,000. So we'll be funded for that, and that will close up last year's grant. We were successfully funded for the current grant that started on the 1st of July for another $117,000. So that will last through July 2022. So I've been in meetings and kickoff calls and whatnot to get that grant started. In fact, I had one today, and I have one tomorrow morning as well. So $117,000. I am going to have an intern for at least a month to help get things off the ground, and then I think heading into the fall, we're going to have more Kent State interns working with me to be more successful with this cycle of funding as compared to last cycle, which kind of pulled me in some different directions. And tobacco just wasn't a priority throughout the pandemic. But we were funded, so that's good. For accreditation, I let the accreditation specialist know that I'm back at the health department. I have submitted more documentation to her for approval, and I have uploaded those into EFAB. So I'm back on the accreditation train, and our date to submit that is at the end of September. I'm going to try to get an additional month, the month that I was not here, have that extended into October. Now that there's not as much political pressure with House Bill 110, it does give us a little bit of flexibility for the document submission.
Back.
I didn't get that part.
Oh, yes.
I missed that.
And then just for some additional items, we still are trying to plan ways that we can attend all the festivals. I'm trying to look at what I can do for the Blues Festival this weekend, because I know there'll be people that, it's not in one location, it's spread out, it's all throughout. So I don't know about having a table that we would reach a lot of people, but I'm trying to figure out how to have a presence there. I'm still volunteering at the Town Sanders Memorial Gardens, and as Mike said, we actually have 2 KSU interns. One is a PhD level student, and her name is Priya. She'll be with us through the summer and hopefully through the fall semester. And then Gaida is here only for about a month. And so we're going to have her work with the tobacco grant. Priya is interested in chronic diseases, not as much with communicable diseases. She's really got a strong interest for cancer. So we're setting her up to do some things that way. But then also she said she might maintain sweeten the pot in terms of getting her to do some of the COVID numbers that God's Love had done before he left. So I'd like to keep that up. So I'd like to have Gaida come to the August meeting so you could meet her and she can share what she did for the tobacco grant. And then later we'll have Priya come. So that's Gaida, PhD also. No, thank you for clarifying. She's a master's student. Yeah. So it's nice to have that expertise. And they're both very eager to get going. Oh, nice. Yeah, Priya came with just outstanding recommendations. So yeah, we're really excited to get us there. So that's all I have in terms of the health department report. So, I'll let you.
Okay, so next up is our discussion items. Joanna, if you want to go through.
Yeah, I was going to go through this report. It's included in your packet. It's actually geared more towards Summit County. We contract with Summit County and this organization to do any air quality testing that we might need. So it's not really too specific to Kent because we didn't have them do too much air quality testing here. So that's just so once they're in your report for your leisure hours, I guess. I did want to remind everybody that the DORA hours have been extended an hour. They were going to just do it for one weekend, but then it just makes sense just extend it. So now I think this is at 11, right? Yes, it's until 11. The Haymakers Farmers Market, Andrew Lerone reached out to me and asked if I would send him a letter of support for partnership for their board wants to do a food hub. And so what that would mean would be local producers, growers of food, trying to get that local food into restaurants and supermarkets so that that local food is right here. It's not just at the farmers market, it's in other places as well. We had the CHIP meeting today, an update, and that was one of the things I was going to follow up with Andrew to see there's a push for healthy prescriptions like your doctor would write 3 servings of vegetables, 2 servings of fruit. Would they fill those prescriptions at the farmers market? So I'll follow up with Andrew to see if he would be interested in doing something like that. Then the other item that came up, I am now the champion for PH Wins, which is a needs and interest survey for public health employees. This will occur. I signed up our department to be a part of this. This will happen in September. So there's just a few little easy deliverables in terms of who's in your department, what role do they play, what's their email, and then working with IT to make sure that the survey, when it is ready, will come through, not going to come up in the firewall. But I know we had looked at doing like an employee satisfaction type survey. I didn't know if this would be something that we could substitute for that, since this is run by the Development Foundation. Now, the only problem I see with it is that health departments under 25 employees will be pooled because they were afraid if we were too small, it would be easy to figure out who said what. So we would be pooled with other Northeastern Ohio health departments. So we might not have Kent City specific data, but we have generalizable data from health departments our size that we'll put together. So I don't know if that would give us the specifics. It's probably not as nice or bad as my point, but I think there's a limit for the employees in terms of what all they're willing to do as well, so I'm gonna try to balance that.
Well, that brings up a valid point. Any efforts that we do specific to this department could lead to a loss of confidentiality, loss of autonomous. So that is an issue.
So I thought if nothing else, maybe let's run through this development survey, see how it is, see what kind of information we get out of it, and then if it's not substantial, if it's not to the degree that we want, then we could always maybe revisit. But I think it would be hard. I think people would maybe not be as honest as we would want them to be. I think this way, with it being full, they can say whatever they want without feeling that fear of ever being able to find out who's support. All right, then Senate Bill 248, that was actually passed. And this I'm going to send out in a link. It's 25 pages. It really kind of ties the hands of local boards of health as well as the state health department in terms of what they can do. It allows the legislature to overturn with the governor and the director for the health department if there's a pandemic or an epidemic and they say, oh, we're going to close this facility, we're going to close this school, we're going to have a stay-at-home order. They would have very limited options and they could overturn it. So I think it's very concerning. We should read through it because all throughout it talks about, can you isolate that? And that's part of the reason why PCG won't send out our letters anymore is because we cannot dictate that. So
this isn't just for COVID, this is for any vaccine.
This is for any
Yeah.
communicable disease. So if there would be an outbreak of measles because maybe people didn't get vaccinated, they didn't keep up to date with their childhood vaccines, there would be limits on what we could do. So it's very concerning.
Giant steps backwards.
I know, right? And so I know that AOHC did a lot of letter writing. There was a big campaign to try to address this with lawmakers to say this is not a good idea. But I guess there's 26 other states in the nation that have very similar, very restrictive laws in terms of what the reach of public health can be from the state level and from the governor's level. So now there's 27 states that have very restrictive laws. So I will send this out so that you can read through it because I think it does speak to what the boards of health are allowed to do now and what they're not. So, the next one we'll actually need to vote on the Penn State license fees. As we know, Aramark has left the campus. They as part of their contract, they own all the food licenses for there was 35, I think there's now 25 FSOs and 1 mobile on campus. So they were not willing to give those back on departure. So that leaves all of those places unlicensed. The concern was technically to reopen them, they would not only need to buy their license, they'd need to go through a planning review, which would be an additional fee. And that would be very cost prohibitive for that many locations. And we've been in those establishments under Aramark, and some of them have actually been closed. But so what we would like to do is hold off and pause on the planning review fee and just let them pay the licensing fee to reopen those under Penn State, and then Penn State would own those licenses. And I think moving forward, we would encourage them if you ever want to have another organization come in, never let go of the food service.
What was the fee?
Well, that was contingent. It was a contingent. They had to do it evidently as a part. I've never read the contract, but that's my understanding that Aramark would not come in. It worked well for Aramark, but it did not work in the favor of Penn State University.
How does it benefit everyone to keep those licenses? I mean,
It was just. They're just being difficult to work with because the broken contract. I mean, again, this is my opinion. This is my opinion.
That's pretty much what it is.
We'll Yeah.
It is the opinion. Unless Chris differs, I don't know, Chris. So, you have to be careful though, because then in other businesses. it'd be like,
Well, they said-
pay the license, fee for
For the planning review, yeah, that is a concern, but I know Justin did approach his contacts at the state level and explain to them the exorbitant costs that would be involved with that, and they would have to be in there and do the planning review, then they'd have to come back and do 30 days, and so they said, how about if we license them and we'll still do the 30 days, and we know that we'll be in there for follow-up inspection. So it's not that they won't just be given free reign to go and do at will, but yeah, it's a concern for precedent setting. So, but as several of their FSOs are class 1 or 2, which is lowest level type of, like, not, they're above vending machines, but that's the lowest level, lowest risk. So it's something to keep in mind as well. And then under discussion items, the last item is a quality improvement program for customer service that we need because it will help us with our bad accreditation. The return, I think, Linda, even though she's working solo, has still continued to get people that will give her great reviews. They'll give her 5 out of 5 for her service with the public, which is phenomenal. But we're having a harder time getting that type of feedback from housing and from food. We have a link at the bottom of our email. We feel like that's too passive. So we're looking at possibly putting a QR code on the back of all of the sanitarians' business cards. That then when they would scan that QR code, they could easily be taken to a quick brief survey, maybe 5 questions about how is your service today? Are the sanitarians responsive to your needs? Do you have a concern? So I don't know if there's any other thoughts. It's just the return rate is so low. I don't know if people are afraid if they complain, that then they'll be inspected more critically, so that they're afraid to participate in the survey, but yet we want their feedback so that we can improve and meet their needs.
How are they offered the survey now?
Via email. There's a link at the bottom of each of the sanitarians' emails that says, please fill out this survey on our interaction.
But it's not one separate, it's not a survey email.
It's not a survey email, so that was something else, yeah.
Because I know when I buy something, like Amazon, we get that, yeah, blah, 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 survey.
I do some of the survey stuff at work and you just have to be more aggressive pushing it.
You have
It's
to
like the
really
biggest
push it.
shift in, talk to someone like, okay, now, tell us where we can improve, use the survey, or tell us what you like, use this.
Yes, they tell us what works, tell us what didn't.
Or what would you like to see, that kind of stuff.
Yeah. So many of the individuals that the sanitarians work with say, I have so many emails, I don't read it, I read the memo line, I read the top 3 sentences, and I don't read past your signature. And
I'm not surprised.
Yeah, so I think the placement is a problem, and that's why I wondered if the QR code might help, or like maybe a follow-up email that said, it's just for the survey. So
And also, a follow-up email specifically for the survey would give you the ability to reinforce the idea that we really want this feedback. This is to improve services. We want to give that back.
Or you could print them and have envelopes that are stamped and addressed to the health department and just have them fill it out. Wow, this.
Right.
The
And
person-
leave it with them.
Right, and say, I'll take it, like, did you fill this out while I'm doing your whatever, and put in an envelope and seal it, and I'll mail it for you, or I'll take it back to the office.
we could try that. I don't know if they would want to prioritize.
And if
your
you don't fill it out, I'm gonna flush it.
Part of the concern is that sanitarians providing violations, right?
Yeah, right.
They might, a business or housing complex might be more incentivized to leave a bad review purposefully because they were just stopped during
Appropriately, but
during
still,
inspection,
yeah,
but still. And it's a lot, it's like Yelp. Not a whole lot of people are gonna leave a positive review on Yelp. They're gonna only respond if they had a really horrible experience.
So I don't know, maybe we could try the email symbol survey. If that doesn't work, go to the QR code on the end of the business cards. And then if that doesn't work, we could try some more. Yeah, okay. So we'll see if we can pick up some customer service responses. Okay.
Okay, that brings us to the action items. The first one is expenditures and encumbrances for May. Are there any questions or comments about them for May?
Need a motion.
Yeah.
Move to approve the expenditures and encumbrances for May 2021.
Is there a second?
I'll second.
All in favor?
Aye.
Opposed? Okay, motion passes. Now looking at expenditures and encumbrances for June.
And I would just say that Justin's conference is going to be reimbursed by a grant. So we'll have those ones.
I assume that stands for city credit card. Is that what CSCC means?
I believe so. Yes. Yeah.
Is there a motion to approve?
So
for
moved.
June?
Second.
All in favor?
Aye.
Any opposed? Motion passes.
And the strategic plan, I honestly, I
We're gonna have to
don't,
move that one.
yeah, I think we're just gonna defer that until August. Because there was not really that many updates, so. Okay.
Also,
The last action item is the KSU licensing fees. Is that
That's what we just talked about, so that they would not have the planning review fee, they would have to purchase a new license, they would keep in their name, and I think they will be called Penn State University Food Service. So, yeah, but they wouldn't have to go through the planning review, but they will have inspections.
So you need a motion.
I need-
to
yeah,
approve that
Because
process.
we want to show that in the minutes that we brought it to the board and then we had discussion. And then
So you're looking for a motion to approve the waiving of the
planning review.
planning review.
While maintaining the license
Okay.
fees and inspection schedules.
I motion to approve the waiver of the planning fees for Penn State University's food service, but keep the license.
I'll second.
I just said a lot.
What she said.
Okay, all in favor?
Aye.
Opposed? Motion passes. Is there a need for an executive session? Okay, well, with that, I think we can adjourn the meeting. Is there a motion?
I motion to approve.
Second. Okay, the meeting has, all in favor?
Aye.
Opposed? Motion passes. Meeting is adjourned at 6:49.